Hi, my name is Jaunia Clarke. I am a community health educator at Bronx Community Health Network. I really wanted to get into this work because I have a lot of family members who have chronic health conditions, and I really wanted to play a role in helping my community get healthier. And I realized that it's more than just telling them what to do to be healthier. There are a lot of things, social determinants of health, that go into it. So if people don't have access to healthy foods, if they don't have transportation to get to their doctor, it's really difficult for them to live a healthy life. So that's what really drove me into getting into the community and doing this work. So my Photovoice picture depicts a church in my community on particularly a rainy day, but the sun was breaking through the clouds, and I think that really depicts the trust that the community has with us, because religion is a really important part of our community. So despite our ethnicities, age, education, a lot of the community really is faith-based. Faith, trust, religion goes really hand in hand in the work that we do. Oftentimes, our patients and community members are kind of at their wits' end and are really struggling to make it through, but they come to us having faith that, we will be able to assist them and get them through this struggle. So the work that we do is really important, building that trust that we can help them get through that rainy day in their life and, be the sun that's shining through for them.
Hi, my name is Anny Rosario. I am a CHW. I work with the New York Presbyterian for the last 2 years. I've been working with the children population, with the pediatrics. How did I become a CHW? First of all, I went to college for community health worker education. I'm an educator in that area. One of my professors, before I got into the program at your college, one of my professors came to me and said to me, I see a future doing community health education. And I jump on it because if they see something in me, a professor sees something in you, it's because you have it to give that to your community. The second part of how I become really a CHW, once I graduate college, I saw these um, subtitles, as a subtitle, like a little commercial in the internet, say, make the role New York is looking for CHW, dedicated person who loves to work with the community. I'm gonna say, that's me. That's the person that you're looking for. A person who loves to talk to people, a person who loves to connect people with the resources in the community, a person who loves to learn and teach all that there is something out there that they can utilize when they are in need. And that's how I become a CHW. And once I got into my interview with my supervisor, it was 2 minutes, and I only said to her when she asked me why was the main reason why I want this job, and I said, my purpose is once I touch anybody's life and I'm there for them, at the end they're not gonna need a person like me, because I try to empower them as much as I can so they know that there are different resources in the community that they can take advantage of them. And the most important part is that I always teach them, if you don't take advantage of these resources, which are completely free, those resources or those programs may be taken away, because if you don't use it, we lose it. So I always teach them that to take care of their family that way and empower them to know that there is resources out there that they can trust. So this photo, the first one I'm gonna talk about with the blue table. I call it the blue table because it's a table that a lot of Latinos have seen in the Heights, in Washington Heights, and all the areas with low income population. These blue tables are resources that people sometimes be afraid to take advantage of it, and it's simple as a cell phone, just a smartphone. And this day is very important for you to have one of these, because most of the information that you can have or find regarding of your health, you can find it here, since the New York Presbyterian has an application called My Charge, and we're trying to teach all the participants how to use it and the benefits of having this in the palm of your hand. So many moms, they wanted to apply for a free phone, but when they see the person in the street providing this phone, they feel like, no, I don't trust this person because they might take my identity and do something fraudulent with it. That's what I come in, because trust is very important. I represent my community, and I'm the bridge between the medical field and my community. So for them to be connected, I have to be the bridge in the middle. And I try to teach them that these resources are very important and that nobody's gonna take their information to do anything wrong towards them. And it's not gonna be something that in the future they're gonna be showing up in the record, oh, you took these resources. These resources are exactly there for you. Once I explain them what they need and why they need them, they trust me to help them apply for the same resources that was given by somebody else outside. So sometimes that trust between my community and the people who also is trying to serve the community by providing this important device, such as the phone, they get lost in the translation, and that's what I'm come here, and to teach them that it's safe, that you don't have to be afraid. If you don't trust them, but they do trust me, and I am more than happy to teach them how to do it so they can also teach somebody else in the future. Like I said earlier, I just want them, my family and my community, to be empowered. So we know that there's resources and are completely free, and they can rely on them like they rely on me.
Hello, my name is Marielena Chacón. I'm a community health worker. I have been working for Norton Manhattan Perinatal Partnership for the past 5 years as a partner with New York Presbyterian. I work in the pediatric clinic, and I became a community health worker, sort of like an accident, but in retrospective, I think I always been a community health worker. I guess being an immigrant, it's something that we try to help each other since we don't know the country, we don't know the language. And that's what we do as community health workers. We assist families to find resources to make it a little easier, the burden of caring for a child with special healthcare needs. And that's how I been working with families, not only Spanish-speaking families, but all families who were connected through the program with me, and assisted them to get services and access programs that they probably didn't know that they existed, but they qualify for it. And that's what makes our job so interesting, because we discover with families and we learn from them to make their lives a little easier.
My name is Donald Carrow. Work for Bronx Community Health Network as a community health worker. How did I get into this position? It kind of found me. I'm a person that never saw myself working in social services or working with communities, but it was something that found me at a young age, in my early 20s. Not knowing what to do when I got out of high school, kind of went for any position, didn't want to go to college. Mom gave me an ultimatum to either be homeless, go to work, or go to school. So I didn't want to be homeless. I didn't want to go to school, so I went to work. And every job that I ever had previously before getting into this type of position was people, dealing with people. If it wasn't a security guard, concierge, porter, administrative assistant property man, all had to deal with people. So, and their problems too. So it was always something that came a part of what I was already doing, not knowing I was being trained to do it. So bumped into a friend who's a pastor who said, hey, I got a position for you. I know you never did this work before. I want you to be a part of this. I got to, working with juvenile youth, that's how I started. And working with the community, especially the Bronx, because I'm from the Bronx, born and raised. So I was able to start working with juvenile youth, and it just took off, and I never looked back, working with all different type of populations, and actually landed just recently with Bronx Community Health Network. They kind of brought me on board, and it's been a good ride since I've been with them and working with the population that we work with, and working with a borough that I love, and be able to just love back, the community that I was raised in. And so this position definitely chose me. I didn't choose it. It was definitely a calling that God put in my lap because I wasn't looking for it. But I love people. I see people in the eyes of a family. The Bronx is my family, and I'm there to serve them. And I've also worked in secular and faith-based organizations. And I'm actually clergy, a pastor who's, called to the Bronx to work with the Bronx and to serve the least, the last, and the lost people of the Bronx. So it's an enjoyment. I love it. Can't do nothing else but it. The Photovoice submission that I gave in was a picture of hands gripping in a circular kind of motion where the key word is trust. Trust within being a community health worker, and what does trust look like, especially when you're trying to build a connection with a community that has barriers, or has walls up, and it's hard to trust when you have been hurt and have been sometimes lied to in whatever situations or circumstances and trials that they deal with on a day-to-day. It's always trying to meet them where they're at. I believe building trust with people is meeting them where they're at and trying to serve a need and being honest with them, being straightforward, honest, always extending affirmations of concern, of understanding, and sometimes 90% of all of it is listening. Sometimes just listening to what their heart is saying, and then trying to help them step by step to get closer to their goal, regardless of what it is. If it's housing, if it's getting them, SNAP benefits, whatever it is, any kind of benefit that they need, any kind of resource that they need, is just listening to their heart and where they're at, and then meeting them there, and then walking with them along the journey, and staying in contact with them within the journey. Because you're building a relationship, you're building a connection, you're building a family and a community, because you never know who you're serving and who you're helping, because you don't know what outcome could be that person can reach back and be like, hey, you remember me? Because that's happened to me a lot of times, where I walk into a space or place and they're like, hey, I remember you, and they know my name and I forget their name. Sometimes I try to remember names, but as I get older, I forget. But it's something where it's affirming to know that every person that I served over the years, I've been happy to meet them again somehow, some way. And I'm grateful that I was used just to help them, just to serve them. It's about serving people, and that's all that matters, and nothing in return. So trust has a lot to do with being transparent, honest, and open with them, and at the same time, trying your best to just walk hand in hand, or even, as a community, to meet those needs.
My name is Lydia, and I decided to become a CHW as a second career after my father had an illness, and I realized that there were a lot of resources that we didn't have or we didn't know about. And that was a prompt for me to see what I could do to help other people in his situation, from getting resources about medical treatments to something as simple as translation. My father speaks Spanish, he doesn't speak English, and we found that it was better that someone else translated as opposed to a family member. So that prompted me to search translation services at schools, and I decided that I didn't want to do that, that I wanted to help people one-on-one. And I joined a CHW program at Make the Road, New York, and after finishing the program and doing an internship, I applied for a job with New York Presbyterian and with a partnership with the community-based organization, Make the Road New York. So my journey continued, that I needed to learn the new technology in order to provide that information to our participants. Basically, there was some mistrust because our participants did not want to talk to someone on their smartphone or on a computer or on a regular phone where they were not seeing their doctor in person. They were just listening to their voice. Eventually, we gained a little more trust with our participants that they were able to do televisits, telehealth appointments with their doctors, and sign up to information like My Chart, where they could get their information, their medical information, where they could make appointments and leave messages for their doctors. But this transition took a long time, especially with elderly patients who do not have the technology required and were not going to get the technology needed, and they did not have a trust in the system of talking to a telephone about their health.